Usa ka pagtuo, usa ka tingog, usa ka katawhan. Cebu Catholic Television Network.
Hello Cebu, maayong buntag. Nagsunta ang kahayag nga nagsulid sa matuod, kadagan sa panghita po. Hello Cebu, maayong buntag Pinoy. Ang katutulungan sa mga katawhan. Hello Cebu, hello Cebu, maayong buntag Pinoy, maayong buntag Pinoy, maayong buntag Pinoy.
Hello Cebu, may buntag Pinoy, adlaw karon nga Lunes, unang adlaw sa tibuok semana natong panag-uban pizza 17 sa buwan sa Pebrero tuig 2025. Sa ngan sa kong partner nga si Attorney Jahn Destacamento, ako yung alagad sa kahanginan Malu Inofando Tabar, uban ko ang sa alas 9 karong buntaga sa atong programang Hello Cebu, maayong buntag Pinoy. Dito maglangan ato dayong ipadangat kining ato ang latest nga pagbana-bana sa lakat sa kahimtang sa panahon. Gikan sa Pag-asa Mactan, Miss Ana Dumdum, good morning.
Good morning, ma'am. Ugma ka na itong weather forecast. And sa Sampangan, ang shear line pa rin nagapektar sa silangang bahin sa Northern Luzon o ang ITCC nagapektar dito sa Southern Mindanao. Sa silangang bahin, ang Northeast Monsoon South nagapektar nga to sa kitang bahin sa Northern Luzon. Dito sa Visayas, posible kita makasinati o panagsama panganuron nga to na sumadag-uman na kalangitan dala sa easterlies. O sa hangin ug sa kadagatan, hinay nga to sa kasarangan na hangin gikan sa amihanan ngadto gikan sa sidlakan ngadto na sa amin ang sidlakan ang magapasilabi o ang kadagatan malinawan nga to sa kasarangan. Diri sa Sugbo, makadagatan na ay paghunas alas 5:42 kanyang buntag ug motaog ining alauna 50 sa kaponon. Temperature forecast ng adlaw na sa 26 to 31 degrees Celsius. Haring adlaw ni silang ganyan alas 6:03 kamuntagon ug mosalop ining alas 5:53 sa kahaponon. Og dili lang ko kutob kini si Ana Dumdum gikan diri sa Dias ni Pag-asa Mactan, maayong buntag ug daghang salamat.
Miss Ana?
Yes, ma'am.
Yes, good morning, ma'am. Tibuok semana ba, ma'am, makasinati tag maayong kahimtang sa panahon?
Well, ma'am, diri sa probinsya sa Sugbo, inig mga padong mo weekend or mga Thursday, mga Friday, ma'am, posible taas atong chance sang natay mga pag-ulan apan wala may kanang nakita nga significant yun nga pag-ulan kay. So far wala tay based sa latest analysis walay umaabot na LP or bagyo nga nakita doon sa atong nasod.
Yes, so far, ma'am, no, over the weekend medyo nakatagamtam tag mga preparation na for Quaresma kind of weather, medyo init-init over the weekend. So unsa man ni paingon na ba ni ngadto for Quaresma nga ingon ani pod nga kainit sa panahon atong masinati?
So far, ma'am, wala sa ang kaning amihan mo gyapon natong naara gihapon yan naapoy later this week possible na naputay murag cold surge. Mapan ang mas makafeel gid na dito sa Luzon kita diri mo ginagmay na lang kaning easterlies may atong most nga masinati and mga March possible mo middle of first week sa March possible mo terminate na mo na pud na siya ang ma-terminate na ang hanging amihan and mo na pud na siya sigdanan sa tong dry and warm season.
So March pa, medyo practice pa dito over the weekend ang kainan. Okay, thank you,
Yes,
Miss Ana Dumdum.
May sa pa yan, ma'am.
Okay, maukat si Miss Ana Dumdum gikan sa Pag-asa Mactan. Karon arita sa ato ang front pages sa mga pamantalaang lokal ug nasyonal atong sugdan sa Sunstar Daily. Sa Sunstar Daily, Digong backs Jonas mayoral candidacy. Sa Super Balita sa Sunstar, Mama Ngayaw-yawan gikulata. Sa The Freeman, Digong backs Jonas for Mandawi mayor amid political speculation. Sa Banat News, sa The Freeman, nibisita sa Kapuyo na apil og priso ni palusot og kontrabando. Sa Philippine Daily Inquirer, Manalo asserts Philippines' rights international law in Munich Forum. Sa Philippine Star, Paul Betts told disclose SOSE and campaign materials. Sa Manila Bulletin, AFP monitoring 403 areas of concern. Ug sa Tempo, harrowing find, PAOK raid yields torture videos of Pogo victims. Mao gatong front pages sa mga pamantalaang lokal ug nasyonal. Sa atong pagbalik, doon na tayo bisita. Unya karong buntaga, atong tukion usab kining mga nagkadaiyan ng mga horror stories no sa kaning mga uban. Ganahan kay mo mananaw ng TikTok, ganahan kay mo mananaw reels, kana magkuto-kuto inyong mga buko-buko, kana yung mga likod din ha. Yeah, the louder the pop, ganahan kaay mo. So karon atong paminawon kana yung maogi makamao, dili ka ng murag nakitaan lang ninyo ba niya inyong gipa kanang sa tawagan na kanang reenactment. So kani atong mahinabi karon sa atong pagbalik kanang eksperto kabahin niini after this break.
Hello Cebu, maayong buntag Pinoy. Maayong buntag Pinoy. Maayong buntag Pinoy.
Discover the beauty of the Philippines. With Philippine Airlines, the country's flag carrier. The airline that lets you feel the warmth of the nation. Mabuhay!
Kaiba sa mga politiko, matagal nang ginagawa ni Ariel Quirubin ang ipaglaban tayo. Kahit sariling buhay inaalay. Ngayon, iba ang laban. Pero tuloy ang misyon ni Ariel Quirubin, ang ipaglaban tayo. Kung medalya ang sukatan at hindi pera, si Ariel Quirubin ang ating bayani na karapat dapat sa Senado. Pag may Ariel Quirubin sa Senado, may bayani tayo sigurado.
Heal me, O Lord, and I will be healed. Save me, and I will be saved. Heal me, O Lord, and I will be healed. For you are the one I praise. You are the one I praise. Sing it with me. Heal me, O Lord, and I will be healed. Save me, and I will be saved.
Ang kinabuhi puno sa hagit.
Sumpi na ka, Dria! Ay, pag-inarte! Pagdita ka!
Puno sa pangutana.
Bata pa gani ka kayo? Nagpuyab-uyab na ka? Kinsa man ako ang masakitin ako din ay karoon na kinsa! Kung si buti mo'y pasabot na di.
Puno sa luha.
Nagpili pang ako nga imong anak o kanay imong mga babae.
Kasuko. Apan bisan mangitbit pa ang imong kalibutan, aduna pa'y nagpahiping kahayag. Aduna ka pa'y kasumbungan.
Mga laman, hanap na.
Dear Tatay,
Tunog na unlod na. Nganong handong na.
Waylaing pagi aron masabtan nato ang Biblia. Kinahanglan nga doon natay relasyon kang Hesus. Hangtod sa layan natong panaguban, daghang salamat siya.
Tunog na unlod na.
Wala na dita, ma. Palod, ma. Sorry, ma'am, na late ko. Nangita pa mong gugod para internet sa kong anak, ma'am.
Ay, wala na yung problema. Pag sinisibo.
Sinisibo, sinisibo,
For your internet connection,
and for the signal of your cable TV.
so fast and straight the transmission to your home.
Sinisibo, sinisibo, sinisibo,
Offers you to have fiber optics.
for your viewing experience, perfect and clear so far.
So great and affordable for you to enjoy.
CEBU Television Network Incorporated offers fiber to the home broadband internet bundled with fiber to the home cable TV connection. CEBU Television Network Incorporated with its operation in Metro Cebu and the whole province of Cebu soon.
And affordable for you to enjoy.
Sinisibo.
Hello Cebu, maayong buntag Pinoy. Maayong buntag Pinoy. Maayong buntag Pinoy.
Balik sa Hello Cebu, may Buntag Pinoy. Ning tuura, we have a special guest. We have with us this morning the clinic director and resident chiropractor of Form and Function Corrective Chiropractic Clinic. A lot of C's there. We have with us this morning Dr. Scott Jahn. Dr. Jahn, good morning.
Good morning. Pleasure to be here.
Thank you for giving us the opportunity to have you here with us. We invited you because we want to ask you about a lot of things. And since you're the doctor, so might as well get it from the one who knows it best.
Excellent.
Yeah, because we've seen a lot on TikTok and a lot on social media, so many horror stories about people visiting a chiropractor, bone doctors, or whoever makes your back pop the most, the loudest. It seems to be going viral a lot nowadays. So, in fact, there was one who just recently passed away, reportedly from bone complications after a session with his chiropractor, or someone who presented himself as a chiropractor. But this isn't here in Cebu. This was in Cagayan, and this is just one of many similar stories, right? So, I'd like to ask you, what do you think, based on your expertise, what do you think happened to that patient who passed away in Cagayan?
Yes, so I'm glad you brought me on here so we can clear up some things. The first thing I see is a lot of misinformation. We're seeing a lot of people reporting that either a chiropractor or chiropractic has caused some kind of issue. And it's really misinformation, because only a chiropractor can give a chiropractic adjustment. It's similar to saying that I went to the gym and I got an injury because I was doing physical therapy. Well, only a physical therapist can perform physical therapy. You can't just go to the gym and do exercise and assume that's physical therapy. The incident in Cagayan de Oro that happened is you had an untrained person who was not a chiropractor. Chiropractors go to extensive lengths through their education. First, you need a 4-year degree, and then after that, you need 4,200 hours of classroom and clinical experience. That's on par with a medical doctor. Now, nobody would ever say, oh, I'm just going to go to a guy down the street and have a medical procedure, right? I mean, a medical doctor could do a medical procedure.
Visiting any other chiropractic clinics and just looking at everyone doing procedures, it does not make you a chiropractor too.
No, you have to be educated. And the Philippines has PTAC, right? The Philippines Institute for Traditional and Alternative Healthcare, which is the regulating body to see that somebody has gone through the steps of education and credentialing to be a chiropractor. The problem is that it's not very well enforced, right? They don't have the resources to enforce. So anybody can call themselves a chiropractor without any kind of repercussions. In America, where I'm from, you can get arrested for that.
Yeah, well, here, there unfortunately, as like some other areas, there are regulators who really is not that much into enforcing a lot of stuff. So, unfortunately so. And in the Philippines, I don't know if you're familiar. I've asked you during the break, how long has it been since the last time you were here to let us know about the opening of your clinic? And I was shocked to know that it's like 3 years.
Yeah, it's been 3 years now.
It's been 3 years, yeah. So in the Philippines, I for one I'm suki. I think you understand already a little bit of Cebuano words. We have a lot of hilot, manghihilot. Those are the chiropractors of our generation, but they don't really have clinical practice at all. So it's just someone that and a practice that we grew up with. So while we are also not discounting whatever it is that they do, there are some really who prefer them, like similar to massage. In your case, what could have gone wrong aside from getting the services of somebody who claims to be a chiropractor, but unfortunately with the incident it became problematic?
Yeah, so the first thing I would say is to check with PTAC to see if somebody has gone through the licensure and their credentials have been checked. And if they're not, then odds are that they're probably trying to take a shortcut. And when it comes to your health, you really don't want somebody who's taking a shortcut. Specifically with the Cagayan de Oro case, I can't speak on what he did, but I assume that he didn't take x-rays. In my clinic, we always take x-rays, so we make sure things are safe, and we can check if there's any kind of secondary issues that might present a risk.
Okay. So I think that in the case of Cagayan, it was like home service.
Yeah.
So if you do home service, unless you bring like x-ray machines, then I guess that's already number one, right? Because we have this common misconception, like I, for one, thought that if you look at me, if you examine me, then you would be able to diagnose, you have sciatica, I think we need to pull your whatever. But no, you need to do an x-ray check.
Yeah, for the excuse me, for the most part, right? I know there are exceptions. Like we don't X-ray children because they're still growing and developing, and the need for X-ray is not as great. But when people come into a clinic, they have the misconception of basing their health on how they look and how they feel. And that's certainly not the case, right? It's the reason why we get mammograms. It's the reason why we get pap smears and blood pressure check, because you don't want to base your health on how you look and how you feel. And an x-ray is an excellent way to check for damage, degeneration, and other things like disc injuries.
So in your clinic, you have that?
Well, in the Philippines, chiropractic clinics are not allowed to have x-ray in the clinic, so we refer them out to an imaging center, and then they send us the image, and then we assess from there.
Okay, so when they visit your clinic, they speak with you, and then you advise them to get an x-ray first?
Yeah, for the most part, right? First, we do an evaluation, right? And we want to make sure that we're not just x-raying everybody who just comes in the door. So we look at their structure, right? With chiropractic, we want to make sure their biomechanics and their structure are sound. And if we notice things like a forward head posture, then we know something's off. And the only way to really conclusively say, okay, well, this is how much care you need, is to measure how far you're off and to assess effectively if there's any damage or degeneration, because your care is going to change depending on that.
Okay. So that person who was posing as a chiropractor in Cagayan, was that someone who was known in the industry as someone who has been doing a lot of things or practicing these things without the appropriate training and license?
So there was very little amount of research on the practitioner on the internet. I don't know him personally, but I saw the video of what he did, and I could tell you that's not in line with the education that most chiropractors receive. The hip is what happened, but he had other adjustments, we'll say, that were not in line with chiropractic safe practices.
Okay. So then we go to the discussion of what is chiropractic practice and who are those people who need it?
Oh, excellent question. So that's where the big misconception is of what is chiropractic. So there's two basic schools of health. There's what's called allopathic medicine, which is where the medical doctors and physical therapists fall under. And their concern is with disease processes. They want to diagnose some kind of a disease and then try and manipulate that to reduce symptoms or something. Chiropractic is the exact opposite. We basically say, from a philosophical standpoint, that there's really no disease. Disease is the absence of health. Similar to saying that there's no such thing as darkness, it's the absence of light, right? So instead of focusing...
Delving into a bit of philosophy.
Well, chiropractic, philosophy is one of the cornerstones of chiropractic,
Oh, I didn't
right?
know that.
Yeah, that's why it gets a little frustrating when you see even like somebody who's trained like a physical therapist say they do chiropractic, because they don't have the philosophy of chiropractic. They have the philosophy of physical therapy. And so they're missing that entire point. They're more doing manipulation just for mobilization purposes. With chiropractic, we're trying to be as specific as possible to move a bone that's been out of place in a specific manner, and we're trying to put that bone back in with a specific vector of force. Right? We call that a subluxation. Right? Sub means minor, and luxation is a term for like a dislocation. And we want to try and manipulate that back into a better position so the body can function at its peak.
Okay, can I just interrupt you a bit? You mentioned something about bones being out of place. What are the common causes of bones being out of place?
So there's several causes, right? We start all the way from birth, right? The birth process can be very traumatic, right? Usually a doctor will either use some kind of a forceps to pull the head out of the birth canal, or suction or something like that. They'll take the head and they'll twist it so that the shoulders will now turn, and that can be the
contraction itself.
Yeah, and that can be the first sign of a subluxation. Twisting a very fragile body can move a bone out of place.
So there can be some patients who have been having these problems because it started from birth.
Yeah. It can start all the way from birth. Then there are other things like ergonomic issues, right? We all spend far too much time on our electronic devices with our head down in this position.
And then that's why we have like hump here at the nape of our necks.
The body's going to grow in the position we most commonly put it in, right? And if we most commonly have our head down in a position like that, that's the way the body's going to start to grow.
So then if you say there are bones out of place in a percentage or not really specific number, but how many of these patients that go to your clinic have been having these problems because it was something that started since birth?
So it's impossible to say when it's like a chicken or the egg kind of thing, because oftentimes symptoms are the last thing to show up. Right? We can only feel about 10-15% of our body through what's called our sensory nervous system. The other 90% we can't feel, right? We can't feel how our liver is right now or things like that. So you can have a problem that's manifesting for many years before it shows up in symptoms. Even a mammogram, a tumor has to be 15 to 20 millimeters before a mammogram will even show it, right? So, but that doesn't mean that you're healthy, right? The tumor is growing and growing and growing before it's diagnosed.
Yeah. How about minor dislocations? What are the common causes here in Cebu?
Okay, so we want to just check our terminology a little. A dislocation is different than a subluxation. A subluxation is a minor clinical movement out of place. A dislocation would be a medical emergency, if you will, because it has to, it's just a one pop back into place. The subluxations, again, can happen for anything from lifting, carrying things that are too heavy, right, to being inappropriate, right? We see it a lot of times with children with backpacks that are very heavy. They don't have the center of gravity where it should be, and now they're stooped over forward, right? Sleeping positions can be a cause of that. Stress is another cause, right? When the body's in a stress state, it's in what we call fight or flight, which is an emergency state, and then it shunts all its energy towards survival, right, when it's not healing and repairing. So there's many different causes for that. Modern lifestyle, right?
True, and also especially after the pandemic, right? When when we started to experience like work from home and school, just at home, just sitting down, facing the computer for the entire day. So that's causing a lot of effects also on people.
Yeah, the average person is not getting the same amount of movement that we were even just 10 years ago because of things like you said, like the pandemic. Right? We're meant to move, right? And when we don't move, the body slowly deteriorates. Anybody who's broken a bone and had it set in a cast knows that when that cast comes off, you can't move that joint anymore, right? So immobilization is the first kind of step towards the grave, right? So we want to make sure that we're moving. That's where exercise is so important, right? Moving on a daily basis.
Okay, for parents, there, as you said, there's been quite a huge difference in terms of lifestyle before and now, especially after the pandemic. And we have a generation of children nowadays who are not going out to play anymore. They don't play basketball, nothing. They just stay on their phones. They do their thing. Everything, even gaming, is online. So is that something that parents should also be worried about? And is that something that's also giving you a lot of like more younger patients?
Yeah, it's not only that, but what we're starting to see is when, at least in my clinic, when we evaluate somebody, we look at the curvatures, the natural curvatures that are supposed to be there. And 10 years ago when I was practicing, we would see people that were in a reverse curve were older people, and they would have a lot of degeneration because it takes a long time for it to get like that. Now we're starting to see people with a reverse curve, but there's not any degeneration, which shows that things have been accelerating because, again, the body's growing in the position we put it in. And if a child is like this for 8 hours a day on a device, it's going to grow that way. But we don't have the degeneration because it takes many, many years for that to happen.
Okay, going back to the practice, how can individuals, if you say layman's terms, how can people who are not familiar with this differentiate between those who are licensed and those who are unlicensed chiropractors?
Yeah, so we mentioned PTAC. That's probably the first thing I would do is check with PTAC, right? I believe there's 70 or 80 registered chiropractors through PTAC, so not a lot, right? After that, most of the times with PTAC, you have to be licensed from your home country, right? I come from America, so I have a current license in America, which can easily be accessed through the internet. And to get a license in America, again, you have to pass an accredited course, which is over 4,200 hours of study. Then you have to take National Board Licensing Examination. You have to pass a rigorous test from that. And then you have to also pass a what they call a fitness evaluation, meaning that you're of good character, right? And you're not just somebody who's kind of a snake oil salesman, so to speak.
A lot here. In the U.S., there's quite a very heavy regulation when it comes to medical practices and those in your field, but unfortunately, it's not as strict as here in the Philippines. So in this case that you are in U.S., you have all the license there. When you came to the Philippines, was there also another process that you needed to do to be able to practice here, or it's just that they're okay with your U.S. license?
I present all my credentials to PTAC. They review it. They look back in the United States and make sure there were no complaints against any doctor or anything like that. They make sure they pass their boards and their license is current. You have to keep a current license, which requires doing continuing education on a regular basis because things change and you want to stay current with the new research that's been done.
Okay, makes sense. What are the benefits of chiropractic care?
So the benefits are far too many to list, but it basically comes down to how well your body functions. Right? Are you functioning at 100%? Right? God gave us this internal intelligence, which gets our body to heal and regulate itself. And when there's interference in that system, the body doesn't function as well. Now, if there's just 10% interference, right, you're functioning at 90%. You may not even know it. You may just get some cloudy thinking. Your energy may not be there. You may just chalk it up to, I'm getting older. Right? Chiropractic allows you to access more of your potential.
But when you mentioned cloudy thinking, maybe I'm just whatever it was you said earlier, a lot of factors. When is the right time for you to say that I think I need to see a chiropractor?
So I may be a little biased because I am a chiropractor, but I believe everybody should be under chiropractic care, just like everybody should go see a dentist. Now, I make the comparison because it's pretty easy for people to understand. Thousands of years ago, we didn't have cavities, right? Mm-hmm. Archaeologists can't find any remnants of cavities in ancient humans. But today, we have cavities because our diet is so different than our natural diet. Same thing with chiropractic care. Our daily activities are so much different than that of our hunter-gatherer ancestors. So we need to take precautions. And making sure that the nervous system is able to function and communicate with the body so it can regulate, control, and heal it in an effective manner is something that everybody should take seriously.
Actually, I was just asking because there are a lot of people who, nowadays, with the internet and Google, people always try to check Google first before checking with medical experts. So I'm feeling this, I'm feeling this. Oh, I will check Google. And then they self-diagnose, which is actually mostly not good for them. If my doctor friends would always say, well, Google didn't put in the amount of work and training that we did, so I'm sure the safest for you would be to check with the proper people. So in this case with chiropractic care, what are the side effects? Coming from you, who's been in this industry for quite some time, what are the side effects that we should know about, and what should we do after treatment?
So side effects, there's no known adverse side effects to chiropractic. Now, glad you brought up Google because a lot of people will Google chiropractic, and there's a lot of misinformation out there. Recently, there's been a report in Thailand of a singer who died, and the report says she died after a chiropractic adjustment.
Yeah, I saw that. Yeah.
But if you further investigate, that's really not the case. The coroner said that she died based on sepsis, which is an infection, right? Not chiropractic adjustment. Furthermore, she died 3 weeks after her last chiropractic adjustment. So she went to the chiropractor because of the symptoms she had from sepsis, but it wasn't diagnosed as sepsis. She also went to a medical doctor as well, and it wasn't diagnosed as sepsis. She just thought she had neck pains and things like that. Went to a chiropractor, and then unfortunately she passed away 3 weeks later, and all of a sudden the chiropractor was at fault. Yeah.
Yeah. Well, do people need to see a chiropractor for back pain, which is common nowadays?
So I would say anybody who's concerned with their health, anybody who wants to get the most out of their experience on this planet while they're here, anybody who wants to express more of their potential should see a chiropractor. We don't want to just wait until symptoms happen. There's an old Chinese saying that we don't start digging a well when we're thirsty. Right? By then it's too late. Right? Luckily, it's not too late when you're having symptoms to come to a chiropractor, but we want to take care of our health right from the start. Because your health is your most valuable asset, right? Without your health, you have nothing, right? I use Steve Jobs as an example, right? Steve Jobs had 1,000 different problems on a daily basis until he got sick. Once he got sick, he had one problem, and that was his health, right? But by that time, he had cancer, and it got too late. But he realized the importance of his health after it was too late.
Yeah. So can those who are experiencing concerns like back pain, whatever, body aches, can they also seek help from other health practitioners, doctors? Or would chiropractors be the best answer if you're experiencing these back pains?
So I would say yes and no. It depends. I mean, you can see anybody you want. Chiropractic is not contraindicated to, say, going to see a medical doctor or whatnot. But we talked about the philosophies being very different, right? When you go to a medical doctor, you're most likely going to get one of two things. You're going to get either a drug or you're going to get surgery, right? And
always,
yeah,
either of the two or both at the same time.
I don't know about you, but I don't know a single person who's taking a medication who's healthy, right? medications don't cause health. They subvert symptoms. And when you subvert symptoms, you make the mistake of thinking you're healthy. And that's really not the case, right? Your body's best defense is its immune system, and part of that is symptoms letting you know something's wrong as the body, like inflammation, for example, right? We see what's called NSAIDs, non-steroidal anti-inflammatories, are one of the biggest selling drugs to control inflammation. But inflammation is your body's first line of defense. That's how your body starts the healing process. So if you're just going to take an anti-inflammatory without first saying, why am I getting inflammation, and investigating that, then the damage keeps on going. And now you've just subverted your body's ability to combat that and start the healing process, right? You really want to just get the body functioning as best as it possibly can.
I have a feeling that my mom, if she's watching us this morning, would tell me, see, I told you, stop taking pain relievers and anti-inflammatories. So you mentioned earlier about this regulatory body in the Philippines. That was
PTAC.
PTAC. Is this also the same association that also checks on the practice itself? Like, do they also check with clinics if they're doing safe practices?
So I don't think PTAC has the resources to police all of that, unfortunately. Because if they did, they would probably shut down people who have not been trained and are doing unsafe practices, like the man in Cagayan de Oro. His procedures are something that, at least in my education, has never been taught. In fact, it's actually the opposite, because you're putting some joints in a vulnerable position, and we saw what happened, right? He fractured a femur, right? So I don't think PTAC at the moment has the resources to complain. Unless somebody puts a complaint in, then
that's when they check.
Yeah.
Okay. What are the commonly accepted practices with chiropractic care, and how do you guys ensure safety to the patients?
So, as I mentioned before, we start with a questionnaire and an interview to see a patient's history. Right? Then we want to look at any past diagnosis or any past studies, or like MRI or X-ray or blood work or whatnot. We do a biomechanical and a postural analysis. Okay, and then we also want to send them out for X-rays if they don't have it, if they're within appropriate age range. Again, we're not going to send out like a 12-year-old for an X-ray. And then we start to realign the spine back to the optimal position that it's supposed to be in, so that the body can function properly.
So where is your clinic located? If our viewers would also want to drop by to visit, where do they go?
Sure. So our clinic is located in Apple One Tower, which is
here,
right across the street from Ayala Mall in Business Park. We're on the 9th floor, and people can reach us through there. They can reach us through our website, any social media. We're pretty easy to find. Form and Function Corrective Chiropractic. You can find us through that as well.
Okay, and what makes you different from the other chiropractic clinics in Cebu?
So I don't know if we're. I mean, I guess we are a little different, but chiropractic, again, the base of chiropractic is the chiropractic adjustment, right? Anything else would support that, right? So in my clinic, we use something called whole body vibration, because after we give an adjustment, studies show that you want to stimulate the joint receptors, right? The brain is a reactive organ, right? It's 40 times the amount of information going to it that it sends out. Now, a lot of that happens in the joints. And if the joints are not functioning properly, we're going to send bad information to the brain, and the brain's going to send bad information back down. Once we adjust the body and start putting it back in a normal position, we want to stimulate those nerve endings and flood the brain full of information. And research shows that the more information the brain gets, just like any muscle, it'll respond by expanding and getting new neural pathways and functioning better.
Good to know. So if they want to drop by for evaluation, they just visit you. You're open daily?
Yeah, well, we're open every day but Sunday, right?
Okay.
Even God rested on Sunday.
Yeah. What time are your clinic hours?
So our clinic hours are on Monday, we're 4 to 7. On Tuesday through Friday, we're 10 a.m. to 6 p.m. And on Saturday, we're 9 until 1.
Okay. Just to be sure, since there's different times and for each day, just check and visit them on Facebook, Form and Function.
Yeah. There's one more thing I'd like to address, if possible,
Sure.
because I've been seeing a lot of people in my clinic asking about the risk of stroke, right? That's the biggest issue that people have, and the biggest complaint that even medical doctors say that, oh, it's possible to get a stroke from a chiropractic adjustment. Now, there's been research done. There's a research that's pretty famous done in 2019 that was published in the Annals of Internal Medicine. And they found that there's absolutely no association between a chiropractic adjustment and a stroke. And then a couple of years later, in 2002, Medicare in the United States further did an evaluation, and they came to the same conclusion that there's no association between a chiropractic adjustment and stroke. But this is where education comes in, because in order to have a stroke, it's called a dissection in one of your vessels in the neck, either a vertebral artery or something like that. You have to have an extension with a rotation. Now, chiropractic education teaches that we don't want to put too much rotation in it. And with the Oro one, thank God there wasn't a stroke, but we saw extreme rotation in the neck, which is, just because you will hear a crack or a pop doesn't mean you've done something clinically to advance the person's health.
Exactly, but they do a lot of these ASMR things, and they like to hear it, but if you do, then I guess the best option would be to go to those who are experts.
That's where the philosophy comes in, right?
Yeah.
Why are you doing it? Are you doing it just to mobilize, or are you doing it to restore proper structure?
Yeah. Okay, so lastly, please invite our viewers to visit you in your clinic.
Sure. So we would love to have you. Anybody who's concerned about their health, or again, who wants to truly see what God gave you and express 100% of your potential, right? You have to get your nervous system functioning properly. And that starts with making sure that the protective mechanism, the spine, is in a proper order, right? And that's where we come in, right? So if you're experiencing any symptoms, right, you don't want to hesitate. But even if you're not experiencing symptoms, don't wait until your health becomes an emergency that you want to try and correct something, right? Let's live the best life we possibly can by taking care of our health on a daily basis.
True. Thank you so much, Dr. Scott Jahn, for visiting us this morning, and we look forward to seeing more of you. We have other questions in the future. Thank you. We will be back after this break.
Hello, Cebu. Hello, Cebu. Maayong buntag, Pinoy. Maayong buntag, Pinoy. Maayong buntag, Pinoy.
Discover the beauty of the Philippines. With Philippine Airlines, the country's flag carrier. The airline that lets you feel the warmth of the nation. Mabuhay!
Heal me, O Lord, and I will be healed. Save me, and I will be saved. Heal me, O Lord, and I will be healed. For you are the one I praise. You are the one I praise. Sing it with me. Heal me, O Lord, and I will be healed. Save me, and I will be saved.
Ma, wala na dito, ma. Palud, ma. akong anak, ma'am.
Ay, wala na yung problema. Mag-Cebu.
Sinisibo, sinisibo,
For your internet connection,
and for the signal of your cable TV.
so fast and straight, that transmission to your home.
Cebu.
Sinisibo, sinisibo,
Offers you to have fiber optics.
for your viewing experience, perfect and clear, so fine.
So great and affordable for you to enjoy.
Sinisibo,
CEBU Television Network Incorporated offers fiber to the home broadband internet bundled with fiber to the home cable TV connection. CEBU Television Network Incorporated with its operation in Metro Cebu and the whole province of Cebu soon.
And affordable for you to enjoy.
Cebu.
Hello Cebu, hello Cebu, maayong buntag Pinoy, maayong buntag Pinoy, maayong buntag Pinoy.
maklaro sad ang ato ang mga pangutana no sa ato ang viewers. Kung naatay problem sa ato ang audio. Okay na.
Ang pulong mo, ang diwag sa dalan ko.
Matag binuhat, dunay konsensya. Kung kini mo ang iyang giya sa pagila sa husto o sayo. Sa kiniladman sa imong konsensya, ikaw matukmod gayon sa paghimo og maayo o sa pagdikay sa dokay. Busa may danon nga pagpamati gayon kung unsay gisulti sa imong konsensya. Kay kung dili ka maminaw nini, guba ang imong kinabuhi o magpuyo ka sa kinabuhi na puno sa sala. Sa 1 Pedro 3:16 ang ingon, batuni ang malinis na konsensya. Sa matagigayon nga kita mubaliwala lang sa atong konsensya, ang atong kasing-kasing mahimong tiga. Hangtod nga mabot na gayon ang higayon nga dili ka na magpanuko sa pagbuhat og dawtan. Sa 1 Timoteo 1:19 nang ingon, ug padayon sa imong pagtuo ug malinis na konsensya. Ang ginagmay nga sala kung magpadayon makamugna og dakong kadaot sa imong kinabuhi. Hangtod nga maglisod ka na sa pagbangon ug dili na mausab pa ang mga pangitabo. Busa may danon ang pagpangayo kanunay o giya sa Espiritu Santo. Kay siya ang magtudlo kanimo sa husto nga dalan nga ngayong subayon. Maigsoon, mo kini ang pulong nga maghatag kanato giya sa atong kinabuhi. Pagampok kita. Lagi ito naman, maglisod kami pagbuntog sa sala nga kanunay magsunod-sunod kanamo. Apan nasayod kami nga sa among pagduol kanimo kami dili nimo pasagdan ug imo kaming tabangan nga magpadawgon kining tanan among gipangayo pinagi sa imong bugtong anak nga si Jesucristo. Amen. Ang samahan sa lahat sa Espiritu Santo.
Ang pulong mo, ang diwag sa dalan ko.
Pulong kinabuhi ni Tatay Dodong Limchua mo nagtapos sa itong tulmanon. Dagang salamat sa Philippine Airlines. Thank you very much, Archbishop Jose Palma. Nanaydayan ng Tatay Dodong Limchua. Thank you, Sir Dennis Tabar. Salamat. At ang mga kaubanan sa TOC, Sir Robert, Miss Inday, Sir Matmat, Miss Maybel, Miss Joanne. Sa newsroom, Sir Michael, Sir Del, Sir Raymond, Sir Bruce, ug diri sa studio si Ferdy. Sa nga sa akong partner nga si Attorney Jahn Destacamento, kunyang alagad sa kahanginan Malu Inocando Tabar, nagang salamat sa inyong papakig-uban ug magkitatag balik pohon sa atong programang Hello Cebu, Maayong Buntag Pinoy. God bless us all.